Hey everyone, I'm just going to give a few minutes for folks to join in, but thanks for joining in on this talk. We'll probably start in a couple of minutes. For those who are just coming in, we're just giving a couple minutes to give some time for folks to join in before we go ahead and start the talk. Looks like we're getting a couple more people in. Let's just wait one more minute and then we'll go ahead and start the presentation. Also want to thank you all for joining. Feel free to chime in on the chat where you're coming from. Love to see it. All right, so let's go ahead and start then. All right, so my name is Félix Manuel Chinea. My pronouns are he, him, él, and I'm the head of diversity, equity, inclusion, and belonging at Doximity. I'm here to talk with you all today about using diversity, equity, inclusion principles to advance digital health equity. So what exactly are we going to talk about? So we're going to discuss the concept of utilizing diversity, equity, and inclusion principles to build diverse teams and foster an inclusive culture that allows equitable product design in the pursuit of health equity. And we'll dive into a little bit more about what that means. But first, let's kind of, establish terminology moving forward. So there's a lot of terms that we use to refer to our community. What we'll be using in this presentation moving forward is the term Latino. And the reason we're using this is to be the most inclusive that we can. What this really does is really center racial equity by recognizing our African and Indigenous roots, as well as non-Spanish speaking people. And it centers gender equity by recognizing non-binary and transgender folks who center that identity. So what we're going to do in this presentation is really moving from DEI in theory to DEI in practice. And we're going to do it across 4 different areas. First, we're going to talk about health disparities and tech disparities. Really, how does tech impact health disparities? Then we're going to learn from past mistakes that others have made, how inequitable tech has really impacted patients. And then we'll talk a little bit about DEI principles and how DEI can really impact health equity. And then lastly, we'll talk about equitable product design, how we can functionally center equity in the product design process. And the one thing I'll call out, although we're calling this equitable product design, I really think that this is a framework and approach that can be applied beyond product into any sort of solution that you're thinking of, whether you're coming from a health system perspective or an academic medical center. First, I want to pose a question to you all. What 3 words come to mind when thinking about the impact of technology on the Latinx community? And you can go answer this question by going to menti.com, putting in this code, or you could scan the QR code at the bottom right, and it should take you directly to there. But as you all enter in the words that come to mind, we can actually see this populate in real time. So I appreciate you all taking the time to offer those words that come to mind when thinking about the impact of tech on the Latinx community. I'm curious to hear what you all think. And don't think that it has to be the perfect words or think too hard about it, just anything that comes to mind right away when you think about it. All right, so we have our first submission, some more coming in. So we've got things like access, telemedicine, translation, WhatsApp. A lot of folks in the community use WhatsApp. Language, convenience, worries. I see trust coming up, reach. So as you can see here, a lot of what's popping up in terms of the words that come to mind for you all is either touching on the positive or the potentially negative impacts of tech on the community. I think what this really drives home is the fact that technology is not inherently good or bad. It just depends on the solutions that we're making and why we're choosing those solutions and whether it serves the community that it's intended to serve. So I think it's important to keep these things in mind about the potential for tech to go either way and what that means in terms of our solution development process. All right, so let's move forward and talk about health and tech disparities. So the American Medical Association Center for Health Equity says, getting to equity and justice necessitates a sense of urgency and ambition. I think this is an important quote for us to start off on, because when you're driving solutions aimed towards equity and justice, it really calls on us to understand that this really impacts people's lives. People's lives are really at stake here, and it calls on us to have that sense of urgency with our solutions. And it also calls on us to have a high sense of ambition about it. Our goals need to be set high, otherwise we're not going to meet people where they need to be met. All right, so let's talk a little bit about the double divide. So health disparities are a type of health difference that is closely linked with social, economic, and/or environmental disadvantage. And to better understand tech disparities, we can realize that researchers have designated internet connectivity and digital literacies as the super social determinants of health. So how do we better understand health disparities in this moment? Well, in the context of the pandemic, we can think about it in terms of access and outcomes. So 53% of LGBTQ plus patients delayed or avoided medical care compared to 41% of their non-LGBTQ counterparts. And within outcomes, about 3 years of life expectancy was lost by Black and Latina Americans from 2019 to 2020. And how can we better understand the impact of technology disparities? We can frame our thinking in terms of connectivity, affordability, and accessibility. So under connectivity, we can better understand that 15 to 24% of Americans lack broadband connection. Under affordability, we know that 24 to 25% less Black and Latina individuals own a desktop or laptop computer. And then under accessibility, we understand that 27% of adults 65 and older do not use the internet. So how do we take this context in understanding disparities and then also combine that with learning about past mistakes that others have made when developing tech solutions within digital health? Well, Dr. Ray Boyd says the solution to racial health inequities is to address racism and its attendant harms and erect a new healthcare infrastructure that no longer profits from the persistence of inequitable disease. I think this quote really calls on us to realize that in order to address racial health inequities, we really have to understand what is the root of the problem. We have to understand that racism is something that we need to understand and learn about and better conceptualize when we're thinking about solutions. We have to understand what those harms are coming from that source. And then it really calls on us to come at this with a systems thinking perspective and drive us towards new ideas of what this system can look like. So let's talk a little bit about the racial bias that past technology has had within healthcare. So we can start off with understanding that lack of data representation affects artificial intelligence performance. So lighter skin tones vastly outnumber darker skin tones in widely used atlases, which led to disparities in AI models' ability to diagnose skin conditions in darker skin. Then we can understand that non-diverse cohorts affect the accuracy of vital medical devices. Black patients had nearly 3 times the frequency of occult hypoxemia that was not detected by pulse oximetry as compared to white patients. And lastly, we can understand that racial ignorance is harmful. 1 million Black adults might be treated earlier for kidney disease if a race-based correction factor was removed from a widely used kidney function calculation. And I think what these 3 examples really hit on is the necessity of understanding what race is and what race isn't, and how to use historical and social contexts to develop solutions when it comes to digital health. So now that we've talked a little bit about historical and social contexts when it comes to disparities, and we've talked a little bit about the past mistakes others have made, where does DEI come into this? How does diversity, equity, and inclusion principles apply to health equity? To start us off, I'll start you off with another quote. So the Catalyzed Tech Working Group, in their most recently released ACT report, says companies must bring a business approach to inclusion and an inclusive approach to business. In other words, DEI and business strategies can no longer be separate. And when I see the word business, I use that completely broadly. So this applies to healthcare, this applies to tech, and this definitely applies to health tech. So what this really touches on is the direction of DEI being integrated in the entire business. It being a strategic approach that is integrated across all business functions and provides a lens to allow the business to actually live up to the values that they say they have. So I think it's really on the onus of leaders to understand this and to really allow and empower this sort of function across organizations, especially within healthcare systems, academic medical centers, and especially within health tech companies as well. So I'm going to pose another question to you all. So how relevant do you think DEI is to developing digital health solutions? And again, you can go to the same website, menti.com, use the same code, or scan the QR code at the bottom right to get there. And we will see your answers populate here. What I'm asking from you all is on a scale from 1 to 5, how relevant do you think it is? 1 being not relevant, and 5 being very relevant. Looks like we're getting some responses in. All of them 5s so far. Love to see it. I did expect that this group would have a little bit of a bias in thinking that it's relevant. I'm glad to see that I'm right. Awesome. So it looks like most of you think that it's very relevant, and I agree with you. And I'll talk a little bit more about why I agree with you. All right, so we've been talking about diversity, equity, inclusion in a singular sentence as one acronym, but I think it's important for us to take a step back and recognize that there's 3 separate components: diversity, equity, and inclusion. As you can see in the quote at the top left here, increasing demographic diversity does not by itself increase effectiveness. And what this touches on is the idea that we need all 3 components to really get at that sense of belonging, which is what we're aiming for within cultures, within organizations. So what happens if you take a diverse organization and combine that with an inclusive culture without equity? Well, you get a culture in which the dominant group or ideology is deferred to for decision-making, opportunities, and promotions. So what's happening here is you have a diverse company, an inclusive culture, but you're not putting folks from historically marginalized backgrounds or underrepresented communities in positions of power where they're able to influence decision-making and actually influence the direction of products that you create. So what happens if we combine diversity with equity? Well, you get a culture of assimilation that results in disengagement and low retention. So what's happening here is you have folks from historically marginalized communities and you put them in leadership positions where they technically can influence the direction of the company and decision-making, but the underlying culture is one in which that forces assimilation and doesn't value their lived experiences to allow that and empower that to influence the culture and direction of the company. So what happens is that in order for them to be able to succeed within the organization, they have to assimilate to the dominant group culture. And if you combine all 3 components, you really get at that sense of belonging, where an organization that engages full potential of the individual, where innovation thrives and views, beliefs, and values are integrated. So how are DEI skills relevant to health? I think this is a great question for us to think about. I think what is a great way to approach DEI skills is understand that it's a lens at which you can apply to any given topic, and there are important skill sets and competencies to have within the DEI function. As it relates to health, I think where we can start off with, where it really helps us understand things, is that race is a social construct, and that race was created as a tool of oppression, in particular for Black and Indigenous communities within this country. And we can take it further from there in our understanding that systemic racism has an impact on health outcomes. So much so that racism has been named as a social determinant of health and a public health crisis by multiple medical organizations. And as we take that understanding further, especially within health tech, we can understand that products reflect the biases of their creators. So technology is not immune to bias and has an impact on health outcomes. And lastly, we can really move forward in our way in the direction that we should be moving forward in there is really improving our racial consciousness, being curious about racial equity through practice and self-education. So one context is relevant specifically to the Latina community and Latina health? Well, I think we can start off by recognizing that historical mistreatment leads to medical mistrust. For instance, US experimentation led to 1/3 of Puerto Rican women being sterilized by the 1970s. We can better understand that health justice is rooted in social activism. For example, Young Lord's takeover of Lincoln Hospital in New York City led to the first patient Bill of Rights. Then we can understand the limitations to immigrant health during COVID-19 by recognizing that limited immigrant coverage prevents treatment and actually impacts everyone. And we can also understand that Latina identity goes beyond language by understanding that Spanish and English proficiency at home are reaching equal rates. So I think these are all examples of better understanding historical and social contexts within specific communities. And by having that understanding, we're able to better develop solutions that actually serve those communities. So how do we take all this knowledge that we've just discussed and move forward with this in a structured way that we can actually bring to scale in a digital health environment? Well, I think we can do this through equitable product design. So Una Kim, CEO and co-founder of Arene, says, our diverse team is critical to product design to ensure those we touch are served in a personalized way. Representation in-house impacts everything from scripting to product design to outreach. So I think this really touches on the fact that Not only are diverse teams a nice thing to have, it's a must thing to have within health tech. We need to recognize and value lived experiences to the point where we equate them with work experience and educational experience, and understand that we need to empower those lived experiences to impact our product design and how we interact with communities and how we touch them through our technology or how we interact with them interpersonally as well. So I've been talking a lot about equitable product design, and I think this is a really good framework for us to understand what that actually means. So this framework is actually adapted from rockhealth.org's Building Toward Equity report, a working model for digital health. And what it tells us is a 4-part framework of how to take our approach in developing digital health solutions to do it in an equitable way. So let's start it off and look at what it says. So first, we start off by centering in the community, where we work from within the community for which you're designing for. Then we work towards co-designing the solution by gathering a diverse team from and/or with connections to the community to design the solution. And next, we develop the right tech by developing technology that does not include or perpetuate bias, really having those systems of checks and balances along the process. And lastly, we want to make it accessible, ensuring the solutions are discoverable, accessible, and usable. So let's dive a bit deeper into this framework. So how are we going to center in the community? Well, the purpose of centering the community is really to build trust with communities by recognizing historical context, investing in long-term relationships, and recognizing disparities require a collective solution. And we can do this by understanding the benefits of using a community-based participatory research, in the fact that it helps us select relevant research questions, develop culturally appropriate metrics, and improves our understanding of a community's unique circumstances. How are we going to co-design the solution? The first thing we need to do is recognize that representation impacts product design and everyday decisions. We need to understand that having diverse teams is a must thing to have. You need to constantly approach situations with an inclusion lens, asking who is not at the table, what voices are we missing, what is this product, who is this product serving, and are they reflected in our teams? I think recognizing that is a vital piece to this. Next, we wanted to design for equity, we must design equitably. So this really gets at the fact that process equals product. So if we want an equitable product, we need to make sure that we have an equitable process. And lastly, inclusion is not the lack of exclusion. So not only do we want to design products and solutions that lack features that are inherently exclusionary, but we want to be radically inclusive in our approach. We want to make sure that we are intentionally including communities and voices that have been historically excluded, and make sure that's part of the process in which we are developing solutions. So how are we going to develop the right tech? Well, diverse teams and representative research absolutely help reduce bias, but ongoing data collection and testing processes are also needed. We can do that by intentionally collecting data, by collecting race, ethnicity, and language, which can be a start, and actually building beyond that. Continuing building trust with communities by clearly sharing context in which data is being collected and addressing any concerns that the community may have. And then lastly, we want to consistently check for biases by creating a system of checks and balances from design to post-launch. So really from the beginning to the end of the process. And how do we make it accessible? Well, this is not a comprehensive list, but I think this is a good place for us to start thinking about language, where we're thinking about content translation and language services, health literacy by keeping in mind reading level and font size, digital literacy by offering customer support to help navigate solutions, thinking about accessibility by adhering to ADA guidelines and continuously adapting for patients with disabilities. And lastly, thinking about devices by creating mobile-first solutions and also making sure that we offer support for older devices as well. So those are the 4 pieces of the framework, but I think now's a good opportunity to kind of take a step back and look back at the framework from a bird's eye view. What this really does is helps us give a structured approach to how we develop solutions. So as we bring in diverse teams, we cannot solely rely on those diverse teams. We all come into this space with biases from ourselves. We also need to standardize approach to help those diverse teams develop tech that centers accessibility and develops the right tech along the way. And I think this is a good approach to be able to do that. And as we start to end off this presentation or go towards the end of it, I also want to leave you all with some words of encouragement from folks in the digital health space and the health equity space, and share that with you now. So Dr. Ivor Horn, Director of Health Equity and Product Inclusion at Google, says, in digital health, it's critical to lift up founders and teams who have lived experience and context around the products being developed. Digital health is more than the code. It involves connecting lived experience to what you're building. So I think this really hits on the theme that we've had throughout this presentation, that organizations are really called to recognize lived experiences of their employees and really have that translate into the products that they develop. And that really calls on managers and folks that are doing the hiring to really see lived experience as much as they value work experience and as much as they value educational experience. And that really has an impact in the products we create, especially in the digital health space when we're talking about impacting communities in an equitable way. Next, KP Yelpala, CEO of Enon Health, says, without intentionality, we're going to see an increase of the digital divide. So many people, particularly the most vulnerable, are not in a place to utilize the tools for telehealth and other virtual care services. So I think what this really touches on is that we can always develop technology that seems really cool, that is really innovative, that is really forward pushing. But if we do that without understanding the historical and social context in which communities come from, we're creating those solutions in a vacuum. And we're creating solutions that may not serve the communities that we're hoping to serve. So it really calls on us to be intentional with the solutions that we create and understanding what the context is in which those solutions are going to be implemented. All right, and Aaron Bali, CEO at Carbon Health, says, design is one of the main things that creates trust between people and their providers. All health innovators should be design obsessed. I think what this really touches on is what I had mentioned before, which is this design thinking approach. By intentionally thinking about the design of our products and our solutions and keeping in mind those historical and social contexts of communities, and doing that in an environment in which the teams reflect the communities that you're looking to impact, the design will inherently reflect the culture in which the communities that you're hoping to serve. And those design pieces communicate with communities in non-word ways. So like in indescribable ways that make them feel seen, that make them feel heard, that make them feel like this was designed for them with them in mind. And those are powerful things that you can communicate to communities to be able to have them actually use the solutions and feel like those solutions actually serve them. All right, so I want to thank you all for joining this talk, and I hope you all learned a little bit of something from this, something new and a new perspective. If you ever want to reach out to me outside of this presentation, here's my information. You can also scan the QR code there. It tells you a little bit more about me. Always feel free to reach out, and I'll let Maribel take some questions or moderate some questions from you all so I can hopefully answer them in the fullest way possible. All right. So,
and Félix.
Yeah, it looks like we have our first question. So how do you recommend approaching this conversation with colleagues or leadership who are not sold on the impact of systemic racism on data and analytics? Yeah, so this is a great question. I think this is something that is not new, that is not going away anytime soon. I think it's when leadership and executives don't reflect the perspectives that are impacted by systemic racism, it's hard to get them to understand that and get them to have the competency level to be able to understand the importance of it. What I really recommend is leaning on evidence-based research. And especially within healthcare and within tech, there's increasing evidence and around this space and the impact of it and the importance and relevance of it to all business functions. As I had mentioned before, there's the ACT report, which is really a full piece of work that is done with collaboration across private, academic, and nonprofit sectors. I think leaning into something like that and showing that to executives about what is the scope of this work and what is the direction of it for this particular industry, especially digital health. I think the AMA Center for Health Equity is another great resource, especially in the healthcare space, guiding us on what language we should be using and what's important when thinking about racial equity. They have a roadmap that they put out and guidance on the subject. So I think they provide a really good resource for those types of conversations to be really rooted in fact and have some heavy evidence behind it. Awesome. So next question. How realistic is CVPR within the tech space? Will this fall under UX research? Yes. So I think CVPR is very realistic in the tech space. I think what it really calls on technology companies to do, which I know a lot of technology companies do not like to do, is maybe slow down a bit. I know we like to develop solutions and do things fast and put them out and test them out in the real world. But I think sometimes it requires us to slow down a bit and have an understanding of how that particular feature or that particular product is actually going to serve communities when it's actually implemented. And I do think that it falls under UX research. I think that's a really big opportunity for us to understand how particular communities and consumers actually navigate that particular product or that feature and get some real understanding qualitatively what their experience is with that product. What is the difference between Latine and Latinx? Great question. So as we all may already know, language is an evolving topic. Latinx is a very new term that is only about like 10 to 15 years new, I believe. And it's increasingly been used in the past like 3 years or so. The main concern or the main criticism with Latinx within the Latinx community and on the outside of the community as well is its ability to be used in Spanish. Latine is a term that overcomes that. So they're both meant to center gender equity and meant to not be gendered in the language, in the word itself. But what Latina offers is the ease of use within the Spanish language, and it also fits into Spanish grammatically. Words like estudiante can be used as el estudiante or la estudiante, so it's a non-gendered term. So E is pretty commonly used within Spanish as a non-gendered letter to have at the end of nouns, and that's why it's being used. And I see it being increasingly used from here on forward.
So I'm seeing many things in the chat, people saying thank you and how important this topic is. And I really want to thank you, Félix, for being here today. I'm going to see if there's any more questions in the Q&A, and it looks like we do have one more question that I'm going to put on the stage.
Yeah, can you give an example of checks and balances in process product development? Yeah, this is a great question. I think this looks different depending on the company. I think it really takes, say for instance, like a product manager approach to understand the product itself and what are the different components. I think a diversity, equity, and inclusion role can provide a sense of checks and balances, especially when a DEI role is understanding of what the business does and how the products actually serve communities and what the products are actually supposed to do. If the DEI person within a given organization understands the product to that level, I think you can put a DEI lens to it as well. I think from a DEI perspective as well within organizations, I think a really interesting topic is taking employee resource groups and really transferring them into becoming business resource groups. So employee resource groups are a way for employees of a given identity to basically organize within a company. So for instance, you can have a Black identity employee resource group or a Latinx employee resource group. And that's a group of individuals that share that identity and have a space to basically collect within there. But I think they can be empowered to do more. I think they can serve to be kind of that internal UX development process within an organization. And I think if you include that within the framework, they can serve as a checks and balances in the process of product development as well.
Thank you so much. And I guess the real test also comes from, like, does your product work for its intended audience? I think sometimes it's possible that companies will find out the hard way that, they didn't do their research early on to understand their end users, right? So that could mean that their product, isn't as effective as it could have been. So that's another way that they are learning that if they don't do their research early on.
100%. And I think it really calls on everyone at an organization to do the work, right? Like, you cannot just overly lean on people from a given identity to catch everything that might be wrong with a product. So it's It calls on folks to really learn more about that historical and social context. And I think it calls also to have representative UX representation within there. So make sure that we're actually thinking about representation when we, pick the users for UX research. And then also collecting data in a thoughtful way. We want to make sure that we're collecting race ethnicity data so we can understand, are we understanding how our products are being used through those lenses? So we don't know if there's a problem unless we collect the data to understand it, unless we have that data and measure it.
Absolutely. We do have a few more minutes left. So if anyone has questions that they want to add to the chat, feel free to do so. If not, maybe we can pass that over to Félix for the last parting words and anything else that you'd like to share before we leave.
Yeah, no, I just want to say that I appreciate you all taking the time to watch this talk. I appreciate you all engaging and asking questions about this. I'm very excited about this work. I think both diversity, equity, and inclusion is a space that's rapidly growing, and so is digital health equity. I think they're both two separate topics, but I do think that they can synergistically work together done in the right way. I think the digital health space is a particular space where you can see that happening if empowered, and I'm excited to continue doing this work and connect with you all offline if you're interested in doing so.
Amazing. Thank you so much for being here, and thank you to all the audience members here today. We are going to go into our next session starting in about 3 minutes, so thank you all.
Perfect. Thank you.